The last test that we can do to look at facet issues is the seated extension rotation test. And this is technically a passive test, even though your patients always really want to help you do it because it's kind of a weird test, the way that you put them in it, but it's important that they're kind of relaxed, or at least as relaxed as they can be when you're going to do that. The other thing, and you guys are going to see that I have to do this, his torso is longer than mine, so when I try to sit next to him, I can't like actually maneuver. So as a clinician, you're gonna have to figure out how you can change your position to make sure that you can do the test accurately. And sometimes this is really easy, like just moving a table up and down, and sometimes you have to climb on the table or you have to do all different kinds of things to make that happen. And so for this test, what you're gonna do, and this is how I have to fix for this test, is you have your patient sit up nice and tall, and then you're gonna put your hand in the small of their back and ask them to cross their arms across their chest. And then you're gonna hug them basically into your body, put pressure on the small of their back, and then rotate them and extend them away from you. And they need to be relaxed. Which he is not relaxed, he doesn't trust me. And then you would go in the opposite direction to see if they have pain in the opposite direction. And this test, unfortunately, doesn't have, well, they haven't reported anyway, sensitivity and specificity for it, but it can be okay. Again, they're typically going to be reporting pain on the side that you're rotating towards, not the side that they're rotating away from, but there's always a possibility that that happens. Just make sure that you always test by lab.